the attitude of the baby. All right? So next. Okay. What are these discomforts in sabi natin, guys? No, nausea and vomiting. Do not pronounce it as nausea. Nausea man yan siya. Okay? And vomiting. So, eat dry crackers. No? Kasi yung kanyang ang soda kasi would really hindi siya kumbaga hindi luod kainin, but you have taken in something na carbohydrates for energy. Okay? Kasi maluya man ang buntis ani. That is why recommended sa buntis because the abdomen is growing, so mapupush niya ang stomach pataas. So there is no room for one bandehado of kanon, no, isulod sa masuka gid na niya. Alright? Kaya small frequent feedings lang tayo. Low fat meals lang kasi mahina po ang digestive capability ng mga buntis. That is why low fat meals lang talaga tayo. Avoid fried foods because it adds up to the fat meals. And of course, avoid antiemetics. Dili pwede mo inom bisan unsang tambal ang buntis unless it is recommended by the doctor or kanyang obstetrician if frequent na yung kanyang vomiting. And any form of medication, no matter how mild the medication is, over-the-counter drugs, herbal drugs, di gina pwede i-take sa buntis. Okay? Is that clear? Kung naa mo yung mga significant others din ha, nga buntis, inom Biogesic kay sakit ang ulo katud ay gutom ra or kulang tulog, so i-rest lang po yan. Bawal po talaga any form of medication. Okay, syncope or being dizzy. So sit with feet elevated kasi sometimes manggod itong tinatawag na pagbubuntis natin, one time sa ating pagbubuntis nadidisi tayo niyan. So we need to elevate our legs for the circulation na kumbaga pa sa kuan mag-backflow siya. Okay? Kung mag-change man tayo ng position, slowly lang po kasi we are prone to dizziness talaga. Then always po tayo left lateral position pagbuntis para hindi maipit yung ating nerve dyan na nagsusupply lalo na sa ating ulo at the same time sa baby inside the womb. Right? Then, breast tenderness. Of course, use supportive bra with elastic strap. Okay, we encourage really pregnant mothers to wear as early as second trimester of pregnancy, no? To wear maternity bra. There is what we call maternity bra. Para masanay na silang gumamit niyan, by the time mga anak sila, may opening niyan sa harap wherein hindi naman overly exposed kung mag-breastfeed sila. Yun lang nipple and areola ang makikita, hindi the entire breast, no? Yan. Avoid soap in the nipples and areola. So wala po talaga tayong nililinis na kahit anong klaseng panglinis sa ating breast kasi it can cause dryness and cracking. No, mag-crack po yung nipples natin which is prone to what? Infection. Na ganahan kaayo si sa ganitong causative agent aning infection na ni Staphylococcus aureus. Ganahan kay siya anang naigata sa sulod. So that is why ma-infect siya, then pus would be formed there, no, because of the causative agent ng infection. So, ayaw natin mag-crack yung ating nipples kasi magda-dry up. Nandiyan naman si Montgomery tubercles surrounding the areola which gives some moisturizer. So, ang gagawin na lang ng advice na lang sa pregnant mom is to dip a cotton to a warm water and then linisan niya yung kanyang areola at nipple. Eh basing gitagip-tip na siya. Alam niya nung tagip-tip, yung mga libag natin, mga dry cells natin, nag-accumulate na dyan. Alright? So, one way or the other, pag magligo tayo guys, no? Ato asad ng hapyud-hapyudon para matanggal. Eh basin niya ang pink, nahimo ng dark brown dahil sa tagip-tip, no? Oh, ganyan yung mga nangyayari. Lalo na pag makikita talaga yung beside or under the armpit, mga side, under the breast, ng mga mama, ng mga buntis, no? So, ina-encourage talaga natin yan area na yan na kailangan merong towel na maghid-hid dyan, no? To clean the breast. Okay? But never use soap. Only lukewarm water lang dyan na siya. Then, increase po ang vaginal discharges. So, necessary po talaga ang proper cleaning and hygiene. Pero bawal po ang douching. Ang douching kasi, pinapasok mo na yung disinfectant solution doon talaga sa vagina, which is very dangerous, no? Kasi you are removing the acidity of your vagina. Ang acidity kasi, yan yung nagpo-protect sa babae against any invading infection. Kaya yung mga mahilig dyan maghugas, every ihi, hugasan dayon, you're making your vulva very alkaline for the bacteria to thrive in. That is why mga tulka-tulka diha, then UTI ka na. No? Kaya bawal po. 2 beses lang po tayong maghugas. Ligo, kung anong oras ka maligo, then before we go to sleep. Okay, mahaba-habang tulog yan. Okay? Then wear cotton underwear. Then consult physician if infection is suspected. Increase kasi ang vaginal discharge during pregnancy. It is because the uterus is secreting enough mucus to create a mucus plug. Ang mucus plug, andun yan siya sa loob ng uterus. Kamotik yun daw. Unya, just above the internal os. Kasi yung cervix natin, merong cervical internal os, merong cervical external os. Okay? So doon nagstay ang mucus plug. Tibugol na siya nga white stuff na parang mucus na nagbara dito sa internal os. Okay? And then some of the secretions would come out to the vagina and making the area alkaline also. That is why proper cleaning and hygiene is very important. Okay, there is a distinct smell also that is being emitted by these discharges. Ayaw naman natin mga moy ang mga buntis, no? Then of course, nasal stuffiness. If this would happen, use tayo ng humidifier or better yet, yung isang plangganang mainit, maligam-gam na tubig na mag-emit siya ng steam na mayroon siyang asin konti, then ipa-inhale lang sa buntis. Akala ko ba naman touchscreen itong laptop ko, ginalaw ko pa naman yung chat, mouse lang pala ang gamitin, wait lang. Alright, naana po yun, admit. Okay, napapasok ko na sila ha. Then avoid nasal sprays and antihistamines. Remember, the nose is coated or nababalot sila ng mucous membrane. Edge ng mucous membrane are blood vessels. So pag nag-spray ka, nag-spray ka ng mga antihistamines or nag-take ka antihistamine, it can be absorbed and distributed through the system ng mother. So gamot pa rin yan siya, guys. So bawal po yan. Mga natural stuff lang ang pwedeng gawin ng buntis to eliminate any discomfort during pregnancy. Then fatigue, always ka mahawi, katulugon ka, no? Frequent rest periods is really necessary for buntis. Then of course, rest ka, then there is a time for regular exercise. Bawal po ang mga stimulants like coffee, Milo, no? Any form of stimulants is not allowed. Okay? Samot nakakapoy ang mama anak, guys. Bawal ba ma-exhaust ang buntis. Sorry. Gi-refill ko ng water ang akong electric fan para bugnaw ang buga. O diba? Okay, urinary frequency and urgency. So, increase oral fluid intake during daytime lang po para hindi tayo mag-ihi during nighttime. Okay? Then, there is what we call bladder training. So, void at regular intervals. Okay? Sleep on the side at night. Wear perineal pads if necessary. Kasi, nahinanok na kagtulog, Kunya wa nakakapugong mag-dribbling of urination kay puno na imong pantog. Remember guys, no? Ma-push man gud sa growing uterus ang bladder. So gamay lang sulod ana, there is a tendency na stimulate na ang bladder to contract, no? Para mangihi ka. Humad na siya na pagawasan ako, kaihion ako. Oh, na. Okay? Sige. Then heartburn, small frequent feeding. Para hindi talaga mag-increase ang acid production ng ating tiyan. Okay? Sit upright for 30 minutes after meal. Dili dahil mo higda. Pwede lang maglakaw, magtindog, maglakaw-lakaw. Drink milk between meals. Then avoid fatty and spicy foods. It will further increase the irritation of the stomach. Avoid antacids unless prescribed by physician. Ito bitong, meron bitong mga tao na hyperacidic kaayo, then mahilig pa talaga magkain ng spicy foods. No? It can further aggravate the situation. Okay? Ankle edema naman. So, the only thing that can alleviate a woman from this one is to elevate legs. At least man lang twice a day. Kay bugat na kaayo ang imuhang tiyan. And then the circulation is being impeded. Or you can wear support stockings. Then avoid one position for long periods of time. And of course, avoid diuretics because it is still a form of medication. So as you can see here, sa mga discomforts, no? Maraming discomforts ang pregnancy pero hindi talaga kaagad-agad binibigyan ng doktor ng medication unless it is really necessary na. Alright? Then, varicose veins. So, ina-advise, no, na mag-wear ng support stockings. So, elevate feet when sitting, lying with feet and hips elevated. Kung nakahiga ka, ang feet mo at saka ang hips mo elevate. Move out while standing, no? Hindi kailangan nakatindog ra ka diha. You can walk, no? Avoid pressure on legs. Like when you cross legs, no? Buntis ba? Mag-cross legs pa? Murag di naman ka cross legs ang buntis. Avoid standing or sitting in long period of time. Then avoid constricting clothing. Bahala na nauso, pero pag buntis ka, dapat wala gyud maka-constrict sa imuhang lawas. Okay? Headaches. Change position slowly. Okay, aside from the headache, if you're going to prop up yourself, no, madali kang mahilo niyan. Apply cool cloth at forehead. Then eat small snack. Baka mamaya gutom ka lang. Then use pain relievers when prescribed only. Minsan, ang binibigay lang na pain reliever ni doc is Biogesic. Nya as needed lang jud siya. Kanagid grabe na throbbing headache na jud kaayo na hindi na makaya ng mother. Even though nagkain na siya ng food, tapos inom na siya ng maraming water, no, halos isulod na niya iyang ulo sa freezer, no, to alleviate the headache, but to no avail, dili jud. That's the time the doctor would say, okay, drink 1 tablet of Biogesic as needed only, ha. There are people manggod may headache lang inom dahil sila tambal. Luoy kay si liver, guys, no? Sa buntis, immunocompromised pa gani, madaot pa jud ang liver is because of the medications taken. Okay, herbal medication man akong gitake, ma'am. Oo nga, herbal medication, but it comes in tablets or capsule. Nag-undergo na yan siya ng process, guys. So, it is considered as gamot. Okay? Okay, hemorrhoids. So, warm seats bath tayo, high fiber diet, increase oral fluid intake, exercise, apply ointment, suppositories as prescribed. Remember, ang atong lubot sad is lined with mucous membrane. It can easily absorb any medications na ilalagay or ipapasok. Alright? So, kailangan lang natin kumain ng mga high fiber foods. Kanya, hindi lang din tayo ma-dehydrate. Every now and then, we should consume a lot of water. Then, of course, we should move. No? Para naman, mag-propel din yung ating, kung ano yung mga na-digest na punta sa ating large intestine. Then, constipation, ganun pa rin, high fiber diet, increased oral fluid intake. Okay, mostly nangyayari ang hemorrhoids talaga sa mga buntis. Alam niyo na kung bakit. It's because of the heaviness, no? So, marami, ang pressure talaga andun. Even, kaya nga, nagkakaroon minsan ng mga varicosities sa mga buntis, kaya nagkakaroon ng hemorrhoids, no? It's because of pregnancy, no? Hindi na kayanan ng katawan ng kabigat, no? Then, of course, in constipation natin, same din, avoid laxatives, good guys. Medication man din yan siya. Then, shortness of breath, rest periods is needed, elevate head while sleeping, avoid overexertion. So, wag mo pa naman paakyatin ang buntis using the stairs. Kaya makita mo na nasal flaring na siya. It is because of the growing abdomen, the diaphragm is really pushed up, right? So, there is no room for the lungs to expand. So, gamay na dyan ang iyahang gininhawaan, no? Ang mother. Okay, backache. So, encourage to rest, use body mechanics. Pwede man siya hindi talaga flat. Pwede siya magamit ng may heels, pero low-heeled shoes lang. Then, of course, exercises. Yun ang sinasabi ko, guys. Ikot-ikot mo ang bewang, no? Sleep on firm mattress. Ayaw po na paghigda ni mo, murag na naka sa ilalom sa mattress, no? There are mattress that is like that. Para kang dinuduyan. Pero, sa buntis na, ginoo ko, no, siya bola, nalaligid, ani. No? Mahirap po. Minsan nga, during the last trimester of pregnancy, no? Pag hindi na nga makatayo ang buntis, so ang ginagawa ng husband, ginataas na yung kanyang paa, yun bali kumbaga ang hawakan ni buntis para makabangon, no? Then, of course, leg cramp. So, needs exercise din sa buntis. Elevate and dorsiflex the feet while resting. Okay? Then, of course, increase calcium intake. That is why it is also advised for buntis, no? Kung kulang talaga ang calcium, ang doctor sometimes nagbibigay ng supplements ng calcium kasi needed man talaga yan para sa ating bones na maging malakas saka muscles natin para hindi din tayo maka-experience always ng leg cramps. Okay? Kasi nga lahat ng nutrients natin andoon po kay baby. Okay, let's go now to the recommended exercise. So here we are, the buntis is sitting using the Taylor sitting. So, squatting siya. It speeds up pushing phase of labor. As you can see, oh, nakabukaka yan siya, pero the feet are fused. No, that is why it is called Taylor sitting. Tapos, ginagalaw yan, guys. Hawakan ng paa, tapos elevate niya yan. No? Para maging strong yung kanyang upper leg, no? When delivery comes. Okay? Then we have the squatting. Oh, kita nyo? Mga hindi buntis lang ba ang mag-exercise? Pati buntis. No? It contracts the gluteals, no? Yung hinawakan ng instructor, no? Gluteals, inner thigh muscles, and abdominals. This can result in simultaneous contraction of the pelvic floor muscles. So, kailangan talaga natin mag-exercise sa mga buntis. Pero pag high-risk individual ka na buntis, nire-recommend lang ng mga doctors is walking, no? Pero not to the point of exhaustion. Alright? Then we have what we call the pelvic floor contraction or what we call the Kegels exercise. Okay, hindi po ito nakikita na exercise, mga ma'am and sir. Ito po ay ginagawa natin sa sarili natin. When we stop urine, kugngan nato ang maghihi or ikibot-kibot ang lubot. This is how you're going to perform Kegels exercises. This strengthen your pubococcygeal muscle, guys. No? Hindi lang po dapat ito ginagawa ng mga pregnant mom or mother in a postpartum period, but also mga lalaki. Okay, your pubococcygeal muscle, no? Diba nagagalaw nyo yung inyong penis? Napapatayo, napapaganyan? Nagagalaw yan, alam ko. I have 3 boys sa aking family. Okay? Kaya alam ko yan. Tapos, ang mga babae, kailangan nyo po ito gawain to strengthen your, what you call this one? Strengthen your perineal muscles. That yung muscle talaga dyan na nasa-strengthen through Kegels exercise is your pubococcygeal muscle. So, dapat kasi, ito yung tinuturo natin sa mga mother na naka-experience na ng episiotomy. Why? Alin ang nawawala sa mother pag hindi siya nag-perform ng Kegels exercise? It's the libido. So what is libido? It is the instinctual drive for sex. Kawawa naman si mother, magiging frigid siya. No? Kasi pagka after panganak niyan, ito dapat yung ginagawa niya. Kegels exercise. And how are you going to say? How are you going to advise a postpartum mother for Kegels exercise nga makasabot siya? No? So, yun ang sabi ko. Pugngan, ikibot-kibot. Ikibot-kibot mo na ninyo, guys. Even when you are sitting down there, sige, do it. No? Lah, tama di ay no, dapat i-contract na ako ni. Oh, even I'm talking with you, but I'm performing Kegels. O, di ba? Ana lang na siya. So, ganun ang pag-instruct mo sa mother. Dili kay, okay, miss, perform, how do you perform Kegels exercise na? Nag-squatting naman siguro siya sa akong atubangan. No, like, what are you doing? Ma'am, Kegels exercise. That is not Kegels exercise. Kegels cannot be seen. No, unless nang bukaka ka din ha, unya mag-anak ka, ma'am, pag Kegels daw, makita mo talaga yan, magganyan-ganyan. No? Pagsabihin mo, kung sa SPMC ka pa, ma-assign, manganak ang mother, ma'am, putla, lagod ng tain ni mo, ma'am, putla, ikibot imong lubot. May mga term na ganyan ang marinig mo sa DR. It is because, pag ang mother hindi talaga naka-fleet enema, no? Tapos nang namista pa siya, unya karon naglibor, may mga anak na, pagtindaghan nagtai, anak. No? Tai ang mauna, usa bata. Sometimes sabay. No? Paglabas na baby. Yan. So, yan yun ha. Hindi mo nakikita si Kegels, guys ha. Okay, so we also have abdominal muscle contraction. So yan o, makita nyo naman mga buntis yan. This is how they're going to do it to strengthen their abdominal muscles. Getting ready for the delivery. And also, meron din yan. Oh, see? Yung uban, sobra kapangga sa buntis. Di na lang jud halos palakpon o ipalihukon. Kato di ay, kinahanglan jud di ay o exercise. Then, we also have pelvic rocking. Oh, as you can see, oh, buntis si Manang. Oh, 8-8. Oh, di ba? 8-8 yan, guys. Then, ganito. May gamit siya na ganyan. Inupuan niya. Then, elevate niya ang kanyang chan. Okay? Gusto ko lang talaga makita, guys, itong mga ganito ba? Maturo. Then, let's go now to labor. This is a series of events when the product of conception is expelled out from the woman's body. So, it is not to say, nag-labor pa siya. So, hanggang contraction of uterus ka lang. Kasi labor lang man. But this is a series of events until the baby is delivered. Okay, regular uterine contractions cause progressive dilatation of the cervix and sufficient muscular force to allow the baby to be pushed outside. Okay? It usually begins when the fetus is sufficiently mature. No? Pag uterine contract na, nag-true labor na si mother, that is the beginning of the event that we should take part. No? So what are the theories of labor? There are 4 theories that would really show na manganak na si baby. You have what you call uterine stretch theory. This is the contraction of the uterus that would indicate labor begins. Okay? Siyempre, magtigas yan, stretch na yan siya. So, contraction of the uterus yan. So, labor begins. Then you have your oxytocin and prostaglandin theory. These two works together, no, to inhibit calcium binding in muscle cells, raising intracellular calcium, thus activating contraction. So if you're going to read about this one, it is much more expanded or expounded, no? Doon sa ating MCN books. Okay? Then we have what we call progesterone deprivation theory. A decrease in progesterone causes uterine changes, thus labor pains occur. Diba? Sinabi ko, progesterone is a hormone of pregnancy. It is a hormone that preserves pregnancy until such time na mature na po si baby, ready for labor, mag-decrease na po ang level niya. That is why magle-labor pains na ang mother. Then of course, placental aging theory. Insufficient nutrients to reach fetus. No longer produce estriol and progesterone. Thus, labor begins. So, meron din po talagang katapusan ang function ni placenta. Okay? That is your placental aging theory. Then, what are the components of labor? You have the 4 P's. You have the passageway. So, what will be the passageway sa mother? It will be the pelvis, the cervix, and of course, the vagina. Kung saan dadaan po si baby. Then, sino man ang passenger? Of course, the fetus and the placenta po. Then, power. This would pertain to the uterine contraction, the uterine muscles, and the mother's ability to push. Yan yung power po. Gaano kalakas ang contraction mo, gaano katibay ang mga muscles na, uterine muscles ni mama, and yung kanyang ability. Kaya nga may coaching tayo during labor. Diba? Mother's ability to push. Sige ma'am, inhale, exhale. Inhale, push. Bilangan pag yun mo, dili. 1, 2, 3, 4. 1, 2. Dugayan pag yun mo. Utog ka na pulo, ma'am ha. Taas gid kayang utong ni mama, ana. So, that is the ability to push. The psych, the preparation of the mother's psychological condition sa labor. Dapat dili siya murag mawala na siya sa sarili niya because of the pain. Remember always, guys, no? The pain in labor is undescribable. Really. No? I know that one because I have gone through that. No? Nakakita na ko mga bituon, ganyan-ganyan na sa mga paningin ko, na nga parang pwede na yun ako anytime mag-snap. Okay. Aminin ko na maliit lang talaga yung pain threshold ko, guys. Pero yung pain ng labor talaga, grabe talaga. Parang mag-crack talaga yung iyong lower, yung back mo, lower back mo. No? So, totoo pa talaga yun na there is yung ating symphysis pubis, guys, would stretch really to accommodate the passing head of the fetus. Pag nakalampas na siya doon sa ischial spine, yung buto doon na nakaganyan, malampas sa baby doon, ibig sabihin you can deliver the baby normally. Alright? That is why the pelvis is very important also. Nadili. Naamang ko yung ibang babae na android pelvis. Balakang sa lalaki na sila. Straight cut. No? Okay. Ayan. We have here the pelvis. Okay. So, just to show you guys kung ano yung ibig kong sabihin. Itong ischial spine, ito siya guys. Itong symphysis pubis na ito, ischial. It stretches as well as yung dito na ligaments na humahawak dito. Mag-stretch din yan siya guys. See? Sa ligaments na yan, may mga blood vessels dyan. Pag na-stretch yan, siyempre, ang sakit-sakit. Andi ba? Oh. So, ito yung part ng pelvis. Grabe yun magawa si Lord, guys. No? Kung balakangin ka na babae, malaki ang balakang mo, swerte ka talaga. No? No? You have an ease, no? Sa pagpanganak. Okay? Mauni siya ang, unsay tawag ani, oy? So, gani siya, guys. Mauni ang sa puwet ninyo, guys, na ma-feel niyo na bone, nga ingong ka nga, linisa sa imong lubot, oy, mauni siyang talinis na naigo. Kulang man kag fat tissue sa imong lubot, mauna siya. Mauni. Ito yung pangalan, ani. Ay, ischium di ay, tuwara. Nauwahi ang araw, guys. Okay. Ay, tuwara. Wait lang. Okay, balik na. So, these are the parts of the pelvis, guys. You have the ilium, the sacrum, Oh, importante ito ha. Iliac crest, you have the coccyx, no? The ischial spine, the bone here. Kung nakalutang pa yan siya dyan, floating pa po si baby. Pero pag nag-engage na, negative pa si baby dyan, guys. Negative ang station, kumbaga. Then this is the pubis, this one. The symphysis pubis, the soft bone here. And the ischium. Kanang ma-feel niyo sa lubot ninyo nga murag bukog. Mao na ni siya. Okay, so to show you, this is the false pelvis. Cross-sectional view tayo. Then, the pelvic inlet, this one. And the true pelvis runs this way, guys. Naa si ischial spine. Alright? Ayan. Okay. Antero-posterior diameter from the sacrum going to the symphysis pubis is 11 centimeters. So, kung oblique siya from the sacrum going to your, anong tawag dito, guys? Ito, pubis is oblique, 12 centimeters. Bakit to sinasabi? Kasi ang mga ulo ng bata, guys, anong posisyon ng ulo pag pass through dyan, kung makakapass ba siya o hindi? Then transverse measures 13.5 centimeters. So this is a gynecoid pelvis. All right? So yan. Ayan. Okay, so sino siya? Okay. Ayan siya. O, ngayon. So, ito siya, napakita ako sa inyo ito siya, guys, before, di ba? Ito yung type of pelvis. So, gynecoid pelvis is the most common pelvis ng woman meant for delivering a baby. Then, of course, you have the wedge. Heart-shaped siya. Para ito sa mga lalaki na pelvis called android. Then, oval-shaped pelvis, platypeloid, and of course, the oval long. Pag ganyan siya, no, anthropoid. As you can see here, bilog siya masyado, guys. That is why the baby can pass through that. So what is lightening? Okay, lightening is the nestling of the fetal presenting part into the pelvis. So nasa ibabaw siya. Pumapasok na siya dahan-dahan sa pelvis. Engagement is the settling of the fetal presenting part into the ischial spine. As you can see, that is why nag-start talaga tayo sa anatomy ng pelvis, kung saan siya located, para ma-appreciate nyo when we talk of the parts of the pelvis. So, settling of the fetal presenting part into the ischial spine. As you can see, no, kanang marag may sungay-sungay siya, andyan na siya. Okay? Then, station begins. It is the relationship of the fetal presenting part to the level of the ischial spine. Alright? So, ito ngayon siya, guys. So, as you can see, itong pink part niya is the fetal head. So, if above pa siya sa ischial spine, guys, -1, -2, -3, 4, 5. Floating pa siya pag -5, 4, and 3. Pero pag -2 and -1, malapit na po siya dito sa ischial spine. Once the head of the baby levels with the ischial spine, it is station 0. So, pag bumaba na yung ulo ng baby, +1 yan, sus guys, malapit na talaga manak ang patient natin yan. Pero pag 3, 4, 5 na yan, crowning na yan, power na lang taga ni mama ang kulang, malabas na si baby. Okay? That is what you call crowning stage na. Ang +3, 4, 5. So, madali na lang yan siya, guys. Pag malabas ang ulo ng baby, ay, ang saya-saya. No? Yan. That is your cross-sectional view. No? Yan. Ano na lang ito, guys. Wait lang. 3 people na po. Ano mo? Sige man sila katagak, oy. Pag ano na, okay, meron na. Okay, meron kang question dito. Ma'am, what if mahimatay ang mother while crowning na? Alam mo, sometimes lang din yan mangyari, Miss, no? Kasi it is because pag crowning na talaga, very excited na po ang lahat. That is why the mother would really see us, okay, one more, again. Parang excited na kaayo. So, kumbaga, dinadivert mo yung attention ni mother na to really push it, no? And then, sinasabay po yung episiotomy sa push, pag crowning na, no? So, pag push ni mama sa kapasya, i-cut ni doc. Hindi na mararamdaman ni mama ang mararamdaman niya, no? So, ganun. Seldom lang po mangyari yan. Sometimes kung malayo-layo pa konti yung ulo ni baby, ginasedate na po yan ng doctors ang mother. Kasi alam talaga ng doctors, masakit na masyado yan pag plus na ang station ng what you call this one? Plus na yung station ng mother. Okay? Okay. Sige. So, let's go now to the cervix. So, this is your uterus. This is the fundus. This is the body. And these are the cervix. So, this is the internal os. This is the cervical canal. Then, dito din na external os. So, hindi talaga to siya open, guys. Fused pa ito, guys. No, dito naglalodge yung mucus plug na sinasabi ko. So, this is by showing you, this is our perimetrium, layers ng uterus, myometrium, and ito po yung endometrium. Dito lang po nag-implant si placenta. At the same time, dito lang po nag-grow si baby. Anong nutrients makuha niya dito sa endometrium? Yun lang po yun. No? And then it is supported by the placenta na meron siyang nakadikit sa maternal wall wherein siya yung kumukuha ng nutrients for the baby to grow. Alright? Sige. So, ito ang vagina. This is the cervix, cervical canal. Alright? Okay, so what is dilatation? It is the opening of the cervical os. Okay? From 1 centimeters until 10 centimeters. Pag nag-reach na siya sa 10 centimeters, considered na siya as a fully dilated cervix. Okay? So, open na talaga siya, guys. Pwede nang lumabas head. Due to uterine contraction and amniotic fluid. So, sometimes, fully dilated si mama, pero hindi pa pala ruptured yung kanyang amniotic fluid. Huwag kag yun magharap sa kanyang vulva. Kung hindi, maliligo ka talaga. Okay? Pag pumutok yan, ay, pwede kang maligo. Okay? Then, effacement is the thinning of the cervical canal. Okay? It is expressed in percentage. So, 100% is a fully dilated cervix. Pag nagsabi yung doctor, fully na tayo, so ibig sabihin, fully dilated, fully effaced na po. So, ready na for delivery na. Okay? So, let's go now to the vagina. So, the vaginal canal has a rugae and capable of stretching but can be lacerated. So, kung first degree ang laceration ni vagina, skin lang po siya. Okay? Pag second degree po, skin and muscles. Third degree, external sphincter of the rectum is already included. Then, fourth degree, mucous membrane of the rectum is affected. So, dito sa third and fourth degree, diyan na nagkakaroon ng fear of defecation yung mga mother natin, postpartum mother. It is because it is very painful na moagi si pupo sa gitahi nga lubot. No? Kaya naabot naman dito sa may puwet. I have experienced this one, guys. 4th degree laceration. I really had a hard time, no? Recovering. Almost a month ang aking bleeding. Kasi bleeder man din ako. No? Then we go now to the perineum. This is the site of episiotomy. Episiotomy, by the way, is the surgical incision of the perineum. Alright? So, there are 3 types depending on the doctor kung anong gagamitin niya. Median episiotomy, right mediolateral ba, or left mediolateral. Alright. To show you the types of episiotomy, pwede si doc mag-cut sa gitna lang, not reaching the anus of the patient. So, median, midline episiotomy. So, kung si doc, galing dito nag-cut siya, pa ganyan, mediolateral po ang incision. Nag-cut na siya niya, nag-extend pa siya ng ganyan. So, mediolateral episiotomy. So, ito po ang nangyayari dyan. This is the head of the baby, guys. Head of the baby, and this is the scissor that would cut the episiotomy. No? Ayan, dito ang episiotomy. It's either, this is the head of the baby that is coming out. It's either right mediolateral or left mediolateral, depending on the doctor. Just to facilitate the delivery of the head. Pero syempre, kagamay-gamay, basta vaginal introitus, di ba guys? Unya, ingani, murag bola ang mugawas sa puwerta sa mother. So, it needs some help. Okay? Okay, let's go now to the fetal skull. So, kailangan man natin malaman bakit ang fetal skull? Because there is what we call molding. So, we have here sutures. No? Hindi po yan siya close when the baby is born. Kaya nga, I have an experience with my students before. Umiyak siya. Kaya sabi niya, ma'am, nabasag ang ulo ng bata. Naku, ha? Paano nabasag ang ulo ng bata? Ano kung mo nag-move? It's because suture lines are not yet fused when delivered. Because there is what we call molding. No? Nag-overlap po ang skull bones ni baby just to ease the head out of the vagina. So, yan. So, okay, yan. We have here the lambdoid suture line. You have the sagittal suture line and you have the coronal suture line. This is the posterior fontanelle and this is your anterior fontanelle. Okay? So, andito na tayo sa ano guys? Ayan guys, pakisulat na lang ninyo ito. Okay? The posterior fontanelle of a baby closes at 1 to 2 months, about 4 to 8 weeks. Okay? 2 months na ang baby, magka-close na dapat yung kanyang posterior fontanelle at the back of the head. Okay? Then anterior fontanelle closes at 9 to 18 months, about 36 to 72 weeks. Dito po yan. Okay? Anterior fontanelle. That is why babies who have sunken fontanelle is diagnosed to have dehydration. Okay? Kasi makikita man. After the fontanelle kasi, sa loob niyan, it's your CSF. Alright? Yes po. Ito po yun siya. Hubon. Okay? Lalum yung hubon. Patay tayo dyan. No? Lalum. So, kulang o breast milk. Guro. Wa ka patutoy si mother. No? Yan. Posterior and anterior. Okay? Mas malaki po si anterior. That is why ito yung kumbaga gina-observe ng mga doctors, no, in assessing the baby for dehydration. Ito siya, 1. Aside from the dry lips, dry ang kanyang skin, no? Yan. Okay. Yan. Ito na, huwag na yan sali, guys. Okay, let's go now to the fetal attitude. That is the degree of flexion that the fetus assume. Okay, as you can see here, no? Well-flexed attitude, vertex presentation. Fetal position ang tawag dito, guys. Nakataas ang kanyang knee until the chest area and nakakross ang kanyang kamay, then nakaduko talaga yan siya. Nakahiga yung kanyang chin sa between the hands, nakaganyan. Okay? That is a well-flexed attitude. Ang military attitude naman, ang flexion, hindi naka-flex ang ulo towards the hands. Kung hindi, nakaganyan lang siya, guys. Murag yung military presentation ang tawag dyan. Then you have your brow presentation. Yung eyebrows talaga, guys, yun talaga ang nauuna. It's either in a transverse position or in a normal position, pero nauna po ang brows ni baby. So sometimes this presentation gives a hard time for the mother and the doctor would really manipulate its delivery. All right? And then kasi slightly hyperextended po ang neck ni baby. So pwedeng ma-injure si baby yung kanyang trachea, no? Yung kanyang breathing ang ma-compromise diyan. And even your submentobregmatic presentation, which is 9.5, face presentation po yan. Full extension face. As you can see, grabe ang hyperextend ng kanyang neck. Tapos ang ulo niya dumikit na sa kanyang back. Supposedly, di ba ganito? O, tingnan nyo ito mga flexion ng mga fetus na ito. So usually the face presentation is delivered through cesarean delivery. It is because it is very dangerous na to move about the head of the baby, no, sa loob ng pelvic cavity ni mama. Mahirap po. Okay? So this is your good attitude ng baby, which is suboccipito-bregmatic siya. So ang kanyang measurement, ang kanyang measurement is 9.5 centimeters. So this is considered as vertex presentation. Right? So ito naman si military attitude or yung ating occipito-frontal. Ang measurement niya is 12.5. Yung may mga broken line dito guys, ito kumbaga yung kanilang Diyos ko Lord, yung kanilang presentation, no, in going out of the pelvic cavity. Okay, poor attitude siya guys, partial extension, occipito-mentum. Pag sinabi mong mentum, chin ni baby. Okay, brow presentation din. So, ang measurement niya is 13.5. Dito, nahihirapan na si mama nito. Sometimes, gina-pull down ni doc ang chin ni baby dito, dahan-dahan, until such time na itong area na ito is mapunta doon sa daanan. No? Then, this is the poor attitude, full extension. So, submento-bregmatic siya. Full face presentation, 9.5 centimeters siya. So, as you can see, ang kanyang neck is visible siya. And then, ang kanyang ulo is nakadikit na doon sa kanyang back. So, sometimes the doctor would not attempt in moving the baby, but instead would decide to do the cesarean delivery. Okay, so not all vertex presentation or kanang ulo, ang nauna, maanak siya naturally. Alright? Sige. So what is fetal lie? So this is the relationship of the long axis of the fetus to the long axis of the mother. So ito siya, vertical lie ito. So maaanak si baby nito. But this is transverse lie. Okay? Sideways siya. As you can see, ang bilog ang tiyan ni mama, pero dito, ginoo ko. No? Palapad ang kanyang tiyan. So, presentation are body parts that will first contact the cervix. So, vertical presentation, vertical cephalic presentation. So, ito guys, kanina. And then we have the vertical breech presentation. Frank breech, footling breech, and complete breech. As you can see here, gigakus niya ang iyahang mga tiil. Unya, gipresent niya iyang lubot. And then, ito naman, nag-una-una ang isa katiil. Single footling. Meron din tayo, guys, double footling. Dalawang paa talaga ni baby ang nauna. No? In FPMC, I have observed, no? Double footling siya, pero inanak siya normally. So, pumasok talaga yung kamay ni Doc until this area just to support the head. No? That is why dapat kasi kailangan yung baby pinapanganak una ang ulo. It's because we are going to suction, no, the passageways, air passageways ng baby. Kasi ang baby once out should attain circulation already. By crying, all the shunts that is located sa kanyang heart would be shut off. Kasi mag-expand man ang lungs, pag cry niya, then yung pressure nun would automatically close the shunts. Okay, I hope you can still remember the shunts. Okay, ito naman, complete breech. As you can see, naulaw siya sa iyahang position. Okay, then we have the transverse presentation. Naanapod ni. Shoulder. Una ang shoulder. Kaluoy po sa tiyan sa mama, no? Kung ingani ang baby. Then, of course, we have the prolapse arm. Nigawas na yun ang kamay ni baby. Okay? Then, we have also the cephalic. Sa twins, swerte kung ganito ang position. Cephalic breech. Ang isa cephalic, ang isa breech. Then, puro breech. Then, of course, you have the cephalic transverse and the breech transverse. No? Ganito ang posisyon ng aking kambal, guys. Cephalic transverse. Hiwa. Oy, CS. Okay, then we have the transverse position. Cute kay sila tanaw, no? Okay. Then we talk of the position. So position of the fetal presenting part to the specific quadrant of the mother's pelvis. So this is anterior, this is posterior. Anterior would be where your symphysis pubis is. Posterior ang sacrum. Then right and left. Okay? Okay. So we go now to the fetal landmarks. Okay. So sa inyong handout, ako na lang dito appeal pati ang picture. It is because for you to really appreciate what are how are you going to determine the fetal landmark. So when you say occiput, this is the vertex or cephalic presentation. Okay, so it stands for O. When mentum naman, chin or face presentation, then M po yung kanyang abbreviation. Then sacrum naman in breech presentation, capital S, small letter A. Acrum yun, wherein scapula or shoulder presentation is the presentation of the baby. Okay? So it stands for A. Fetal position naman is represented by 3-letter abbreviation. You have the first letter for left or right, or L for left, or R for right. Okay, the second is the fetal landmark. So this is the fetal landmarks. Either is it O, M, S, A, or A. So minsan, sige, mamaya. Then third would be anterior, posterior, or transverse. Alright, so may example tayo. Ayan. So this is left occiput transverse. As you can see, ang mother is, yung kanyang vulva is nakaharap sa atin. So definitely this would be the right side of the mother and this would be the left side of the mother. So saan nakaharap yung kanyang occiput? Sa left side ng mama. Okay, this would be left occiput anterior. Okay, anterior man ito. So nandyan man siya. Ang kanyang ulo, ang kanyang back of the head is towards the anterior part, diba? Anterior, posterior man tayo. Then, ito naman is left occiput, anterior man yan. Kasi andito man. Okay, next example. So, you have here left occiput transverse. Yung occiput talaga ang tingnan ninyo kung saan siya nakaharap. So, dito sa left side ni mama. So, left occiput transverse kasi naka-transverse position si baby. Transverse ang head ni baby. Okay, then right occiput transverse po. Next would be left occiput posterior. So, andito na siya sa may petan, yung kanyang occiput. Okay, then sa left side ni mama. So, left occiput posterior. So, right occiput posterior naman, the opposite side. Then you have the direct or nakaharap talaga siya doon sa symphysis pubis, and that would be direct occiput posterior, or the kabila naman, direct occiput anterior. Okay, ang occiput titingnan nyo guys, naka-anterior siya. Ito naman posterior kasi nakaharap si baby sa symphysis pubis. Alright? Then you also have the right sacrum posterior. Lagi oy na napoy nanuktok. Okay. Okay. So we go now to the placenta, placental separation. So these are the 4 signs of placental separation. So Calkin sign is what we call the globular sign, globular shape of the abdomen. Ano man eh? Globular shape of the abdomen ito guys, ha? The Calkin sign. Typo error. Then the second would be the fundus rising in the abdomen. And the third would be sudden gush of blood. This will show if there is detachment already of the placenta from the maternal wall. Then, of course, followed by the lengthening of the cord. This would really entail na palabas na po si placenta. Okay? Na nag-lengthen naman ang cord. So, what are the two types of placental delivery? You have the Duncan delivery and, of course, the Schultz delivery. The Duncan delivery is the maternal side, which is dirty, considered as dirty, bloody and dirty. And Schultz would be the fetal side. It is shiny, no? Fetal side. Then we go now to the power or the uterine contraction. So, dito guys, increment pag-increase ng strength ng uterine contraction, then the peak of uterine contraction. Decrement would be the decreasing intensity of uterine contraction. So, from the first contraction until the end of that same contraction would be your duration. Then the first contraction to the beginning of another contraction is your frequency. Okay. From the end of the first contraction to the beginning, no? To the beginning of the next contraction is your interval. All right? So that is the characteristic of the uterine contraction. So dito naman, intensity is the strength of the contraction. Madadali, no? Pero dapat doon makita nyo. Wait. Ito ang strength ng contraction. That is why the arrow. Okay? Madali lang naman ito guys ng increment. Pagtaas, acme, the peak. Decrement, ang pag-decrease ng intensity ng contraction. So these are the meaning of such. The one that I'm talking about. Yung hindi nyo nakuha. Sinali ko na pala din eh. Okay? Yan. Okay, next, the difference between the false and true labor. So false labor, makikita ninyo, there would be a regular interval of contractions. Pag true labor, gani, regular na po yung contraction. So ang false labor, pain sa abdomen, pero ang true labor, the pain starts at the back of the abdomen, sa lower back. Okay? False intensity remains the same. Pero pag true labor, contractions are intensified. Habang tumatagal, lalong lumalakas yung contractions. At tumatagal. Okay? Intervals remain long sa false, pero pag true labor, intervals gradually shorten. So, 1 to 2 minutes na lang, pertinang sakita na guys, no? Makapahulay lang ka after a minute, then after a minute, aguy, nanasad, no? So, nag-shorten yung time. Then walking gives relief sa false labor, pero sa true labor, pag nag-walk ka, lalong sa sumasakit. Maunang muhunong jud ka, mura kang magtiko-ko sa kasakit. Okay, bakit pinapalakad? Usually, ang pinapalakad yung buo pa or intact pa yung bag of water. Pero pag ruptured na yung bag of water ni mama, never na siyang palalakarin. Okay? Sa false labor, no bloody show. But with the true labor, there is already blood trickling down. So, ibig sabihin, no, give way na po yung protection, no? Or nag-open up na po si cervix. Then, sa false labor, no cervical changes. Sa true labor, there is cervical dilatation and effacement already until fully na yan siya. Then, of course, sa false labor, contraction stops with sedation. Pag pinatulog or pinahinga si mother, binigyan ng sedation, nagsistop po yung contraction. Nagpapahinga din si baby. Pero sa true labor, hindi na siya ma-stop even with sedation. So what are the preliminary signs of labor? So there is what you call lightening. Then of course, loss of weight. Particularly if loss of weight ito ng mother, particularly if there is already ruptured o bag of water. Siyempre, natanggalan ka na, ilang kilo din yun, no? Na nakakoat sa baby. And then, nagbe-bleed ka na. Then, the mucus goes out. So, maglulose ka talaga ng weight. Then, increase in activity level, no? Na hyper ka. So there is Braxton Hicks contraction, irregular contraction, makaka-feel ka niyan. Then of course, upon internal exam, ripening of the cervix is noticed. Then beginning dilatation ganyan. Okay, rupture of membranes and bloody show. Then stages of labor. So the first stage natin is what we call the dilatation stage. It comes into latent, active, or transitional phase. When the dilatation stage reaches transitional phase, so it goes near the second stage, which is the fetal expulsion stage. Okay? Third stage natin is placental stage, and fourth stage is the recovery. Okay, so I have here a table wherein criteria will be dilatation. Pag latent, 0 to 3 centimeters ang dilatation ng cervix. Pag active naman is 4 to 7 centimeters, palapit ng palapit na. Then transitional 8 until it is fully dilated already. Then ang intensity niya, intensity ng contraction natin, mild pa lang yung pagtigas-tigas ng tiyan sa latent phase. Pag active phase pa, nakiwi na ang nawong ni mama, murag nakafeel na siya pain. Pero pag transitional na talaga, wala na. Para na si dato puti yung mukha ng mother, no? Manlagom na. Bugnaw kayo, pero ang singot daw mais kadagko, no? Oh, ani dire sa transitional stage. Then ang duration natin as criteria sa latent phase 15 to 30 seconds. Active naman 30 to 60 seconds. So, pa-shorten ng pa-shorten. Okay, then transitional would be tagal ng patagal pala, 60 to 90 seconds. Ang ibig sabihin ng duration, yung katagal ng contraction pala, guys. So, kung seconds lang dito sa latent, umabot na ng minute pagdating sa active. Pag transitional, minute, 1 to 2 or 3 minutes, agoy, pating sakita na anak. Okay, ang interval naman, 15 to 30 minutes, latent pa, wala pa, lakaw-lakaw pa si mama, ngisi-ngisi pa, and then, pwede pang kumain. Then, 3 to 5 minutes, active. Okay, pag transitional, 2 to 3 minutes na. So, malapit na siya mga anak. Ang length, ang latent phase is 8 to 12 hours. Active phase is 2 to 3 hours. Transitional is an hour lang. Ang emotions naman ng mother dito, excited siya sa latent phase, tawa-tawa here, tawa there as she communicates with the staff. And then active phase naman kasi nakakaramdam na siya ng sakit, natatakot na siya, anong mangyari sa kanya. Then of course, sa transitional, malapit na talaga siya mga anak, hindi mo na talaga maintindihan, ayaw na niya magpagalaw, there is already abdominal guarding or what, no? Irritable na si mama. Okay, sa diet naman, that soft diet, pwede pa. Si mother, pag active labor na, NPO na po. Pagdating ng 4 cms, NPO, even 5 cms nga doon sa hospital natin, sa mother hospital, nag-fleet enema na po si doc. Okay, then transitional NPO na. Then bag of water naman, latent, intact bag of water, active, ruptured bag of water. Then of course, transitional, meron kasi mga mother na grabe talaga katibay ang kanilang amniotic sac. No, hindi talaga siya nababasag or napupunit even in the active phase of labor. So ang ginagawa ni doc, gina-arm niya. This is the artificial rupture of membranes. No? We have some instruments na ginagamit natin dito. Okay? Yan. So what would be the nursing care during the first stage of labor? Of course, you do your admission care. No? Receive the patient, routine admission care natin yan. Receive the patient, show the patient in the IE room wherein she will be further assessed by the doctor. Of course, you do your data gathering. And then when the patient is ready, change mo na ang clothing niya, napaihi mo na siya, then tawagin mo na si doc kasi mag-assist ka na for internal exam. Then of course, Leopold's maneuver is done here. Then monitoring of the FHT. Then monitoring of the uterine contraction. Then promotion of change in position to left lateral. Then empty the bladder. Ang hygiene niya while waiting. Then enema administration or fleet enema at 5 cms. No? Pag 5 centimeters dilated na po yung patient, nire-require na po tayo ng fleet enema. Then perineal preparation. Then analgesic administration as ordered pa. Pag latent phase pa lang, gusto pa patulugin ni doc, nagbibigay tayo ng sedation. Then of course, assist tayo sa administration of regional anesthesia if the patient is for anesthesia. Then start IVF as ordered. Sometimes patient in latent phase, hindi pa muna lalagyan ng IVF. Pagdating sa active, tsaka pa siya lagyan. Then assist in amniotomy. We have the Alice forceps for that. And of course, kung walang Alice forceps, we can use the amniotome. Okay? Amniotome ang tawag. Then watch out for subirba. Yung signs wherein you would put the patient in the delivery table na. Then, of course, emotional support is badly needed by the patient here because undetermined na po yung emotions niya. Fear of the unknown ang kanyang nararamdaman at this moment. Okay? So, when to position the patient for delivery, you have the mnemonics of subirba, which means S stands for severe uterine contraction. Then U for urge to defecate. B, bearing down sensation. I, increase in bloody show. And of course, R, ruptured bag of water. B, bulging of the perineum, which would indicate really na andyan na po yung ulo ni baby. Then A, anal dilatation. Nag-turn inside out po yung anus ni mother once the baby's head is already down. Okay? So what are the cardinal movements or mechanisms of labor? So you have first, the descent. Okay? Ang pagbaba ng ulo ni baby towards the maternal pelvis. Okay? Or this is what we call the engagement also. Descent or engagement. Then we have the flexion. Yung fetal position ni baby, magfa-flex siya, getting ready to travel outside. Then, nag-internal rotation si baby. So we have 6 cardinal movements. The first one will be the descent or engagement. The second will be flexion. The third will be internal rotation. Then you have the extension. No? Ito na lang sa inyo guys. Extension. Those are just pictures. No? Extension. Then, ano ba? Descent. Pang ilan na yun? Nawala na ako. Descent, flexion, internal rotation, extension 4. Then you have the external rotation or what we call restitution. No? Pag-ikot ni baby sa labas. Pag-ikot ni baby sa labas, no? You get to hold the baby's head, and you try to pull it down to expose the upper shoulder and pull it up to expose the lower shoulder. So external rotation, and then the expulsion is the 6th. Last cardinal movement in labor. All right? Okay, so this is the actual picture. Ano man ito? Okay. Oh, teka guys ha. Okay, so mag-play lang ako nito.
During a vaginal childbirth, the first stage of labor lasts about 12 to 19 hours and starts when your baby settles lower into your pelvis. In response, your cervix begins to efface or become thinner and dilate or widen. During this time, you may feel strong, regular contractions occurring every 5 to 20 minutes and lower back pain and cramping that doesn't go away. You may see a brownish or reddish mucus discharge, which could be the mucus plug at the opening of your cervix, falling out. Your water may break, which can either be a large gush of fluid or a continuous trickle. If you experience any of these symptoms, contact your doctor or midwife to see if you should go to the hospital. At the beginning of stage 2 of labor, which usually lasts from 20 minutes to 2 hours, your cervix is fully dilated to 10 centimeters. And your baby's head has moved beyond the cervical opening into your birth canal. Your doctor or midwife will instruct you to push during your contractions and rest between them. In a normal delivery, your baby's head will rotate to face your back. During active labor, your uterus is divided into an active segment that contracts, pushing the baby downward, and a flexible passive segment that remains relaxed, stretching to provide more room for the baby to pass through. When the top of your baby's head appears, or crowns, your doctor may make a small cut, called an episiotomy, to enlarge the vaginal opening. Then, your doctor or midwife will give you instructions on how to push your baby out. As your baby's head passes through the birth canal, it molds into an elongated shape. An elongated head shape will resolve itself within a few days as the skull bones shift back into place. After your baby's head exits the birth canal, his or her head and shoulders will rotate to help the shoulders pass through the birth canal. Your baby's shoulders are delivered one after the other in order to fit through your pelvis. Once the shoulders emerge, the rest of your baby slides out easily. After your baby is born, his or her umbilical cord labor, which may last 5 to 30 minutes, mild contractions will help push the placenta out of the uterus. During this stage, you and your baby may begin bonding through skin-to-skin contact and breastfeeding.
All right. So that is how it is, no? Sa pagpanganak. All right? So ito naman yung mga actual pictures natin, no? As you can see here, dili ni siya tinai, guys, ha? This is the head of the baby. Mao na siya nagamold, makunot na siya, no? As you can see doon sa presentation kanina, no, 'di ba? Mag-overlap or magdidikit yung mga skull bones, no, to facilitate the delivery of the head. So yan yung crowning, guys. Okay? Then easing the head out. No, yan. Madugo ito, guys, ha. Yung sting animation natin, wala talaga maski anong bahid ng dugo, no? And then assist in the external rotation. Sa demo nung sa video, mag-assist ka talaga pulling the baby down to expose the upper shoulder and pulling the baby up to expose again the lower shoulder, and that's the time the body would follow. Ganun. Mabilis lang talaga ito, guys. That is why the baby is very slippery kasi full of mucus siya, blood, mucus, at kung ano pa. Okay? Then the initial suctioning of the mouth and nose. This is done if the baby is already experiencing, no, difficulty. But for now, sa ang tawag mo dyan, sa ano ng Department of Health ngayon, hindi tayo nagsasuction ng mouth and nose, but rather nilalagay natin sa abdomen yung baby, sa abdomen ng mother, for the baby to cry. I-dry up mo natin yung baby kasi masyadong slippery, and then pagkatapos niyan is i-rub natin yung back ni baby. That is why the baby would cry. What do you mean by tilt? What do you mean by tilt? Kasi sinusuportahan man yan, the baby cannot move at the moment. Okay? Once it is out, it is supported by your hand. It is supported by the practitioner. And then by the time hindi pa kaya ni baby mag-ano ng ulo niya. But if you're asking for the expulsion of the head, so it is a natural occurrence talaga siya na magganyan siya, yung parang magganyan siya, magdaan siya sa puwerta ni mama. Okay? Pero pag sabihin mo, pabayaan mo lang na maghang, tapos mag-tilt siya, no. No? Supported by the health practitioner yan siya. Supported by the doctor. Did I answer your question? Okay. Thank you. Okay. So yan. Deliver the shoulder. Uy. Nangyari. Okay, then Okay, then deliver the body. As you can see, no, murag patay naman yung bata na ni, pero buhay po yan siya. It just needs, anong tawag mo dyan? Stimulation. Alright? So, clamping and cutting the umbilical cord. And then thorough suctioning of the newborn is done. But if the baby cries, this is the vaginal introitus of the mother, guys. No? Ayan, no? Lumalabas pa yung cord ni baby. Hindi pa po naputol all through and through. Okay, thorough suctioning of the newborn is not done actually if the baby is crying already, because that is prohibited now as practiced by every institution. Right? Once the baby cries, no need of further suctioning unless the pediatric doctor would tell us na, ma'am, suction lang tayo again, ma'am, kasi may naririnig akong kakaiba sa chest ni baby. So that will be the time for us to suction. Okay? Then, ito po yung placenta in actual. No? Okay, may membrane po siya in order for us to check the cotyledons ng placenta. So, we need to open up the membrane. So, this is the natural itsura of the placenta. Veins yan siya, veins. Okay? So, what is our, what you call this one? Wait lang guys. What is our nursing care on the second stage of labor? So of course, no, sa second stage, mag-start man siya sa lithotomid position. We prepare the patient for delivery. We do perineal flushing, okay? But we do not show off skin of the mother by draping them aseptically. Okay, then we teach them how to breathe during uterine relaxation. Pero we also teach them the technique pag nagkaroon na ng uterine contraction. So we assist also in episiotomy. So we do Ritchen's maneuver. This is the first maneuver during the delivery, the actual labor process. Okay, Ritchen's maneuver is the applying of pressure on the perineum to prevent further bleeding and laceration. Kasi nag-create man tayo ng episiotomy. So the nurse would take hold of the operating sponge or the OS and then apply pressure on the perineum to prevent further bleeding and laceration. Once the baby's head is out, you cannot just remove your pressure on the perineum or else it will be further lacerated. Okay? Then ease the head out, wipe the face, and do initial suctioning. But just like what I have said a while ago, no, bawal pong mag-suction. We just wipe the head out. We just wipe the face of the baby, remove some excess blood or secretion that is coming out from the nose, and we put the baby on the abdomen of the mother. No? And then, yun ang wait for external rotation, then pull head downward and upward to deliver the shoulders, then deliver the body. Okay? Take note of the time of delivery and of course the sex of the baby. That is very important, guys, no? Kasi sometimes yung nakakalimutan, tanong ang CI sa'yo, ano ang sex ng baby mo? When we talk about that one, we are not talking about your own baby, ha? We're talking about the baby you are handling. Okay? So, kailangan mo malaman anong oras siya lumabas. The whole body talaga na naglabas na-carry mo, na nilagay mo na sa abdomen si baby. So, that would be the time for you to check for the time of delivery. And of course, kambal niyan is the sex of the baby. Then, place the baby on the mother's abdomen. Then, palpate for the pulsation of the cord. If pulsation stops, no, hawakan mo ang cord ni baby. Nagapitik-pitik pa yan. If the pulsation stops, that will be the time for you to clamp the cord 1 inch, no, from the abdomen of the baby using a plastic clamp. No? Ano ka na about 1 inch? 1 inch is about this big, no? Ganyan ka lang. Okay, clamp mo na yan. Remember, just like what I have said, no? Very slippery, so you need your 2 gloved hands, no? Sterile gloves hands to hold the plastic clamp. And really, if you hear a clicking sound, that would mean that it is locked already. Bawal pong birahin. Baka magka-code blue tayo. Nag-bleeding ang baby, kaya natanggal mo ang cord. Oh my goodness. So, you really need not to pull, but steady lang yung pag-clamp mo ng cord. Okay? Then milk the cord at least 2 centimeters towards the vulva. Before, the practice is milk the cord towards the baby to give the baby extra blood. But now, from the plastic clamp, we milk the baby 2 centimeters towards the vulva or sa mother. And then we do not take off our hand. We put another clamp. No? Don't worry guys kasi you will be taught pagdating natin sa DR. Ini-initial ko lang kayo para at least when you see it in actual talaga, ma-apply nyo na. Alright? So, at least 2 centimeters from the plastic clamp towards the mother. Then do not take off the hold. Then get a clamp and then clamp again. Okay. Remove your hand from the cord. Hold the clamp. Make sure it is locked. Okay. Then, then you cut the cord between the 2 clamps. Okay. Actually, in the real setup, we do not cut it in between the 2 clamps, but rather we cut it near the plastic clamp. Okay? Yan. Ang hirap mag-explain nito ng ano ba, walang demo. Okay, so the third stage of labor would be the placental stage. So, I have already mentioned this one and this one. So this is the what's called signs for placental separation, no? And this is the 2 types of placental delivery, the Schultz and the Duncan. And then, okay, so this is the detachment and delivery of the placenta. All right, so yung placenta natin mag-detach sa maternal wall. Okay, so blood would gush through this, coming out to the vagina. So this would really indicate the gushing of blood sa detachment ng placenta sa maternal wall. Alright? That is then next would be the lengthening of the cord. Siyempre, pag pablabas na yung placenta, tataas na yung cord na hinawakan mo sa labas. So this is the actual, no? This is your Schultz and this is your Duncan. Okay? Okay, so nursing care on the third stage of labor. So wait for signs of placental separation. Do the Brandt-Andrews maneuver. No, this is the second maneuver that you're going to do right after the delivery, of the baby. Diba ang first natin is yung Ritgen's maneuver, applying pressure on the perineal cavity, perineum of the mother. Then the second maneuver will be your Brandt-Andrews. Kasi right after the delivery of the baby, you're going to cut the cord. And then yung instrument, i-coil mo ang cord kasi mahaba man yan. Coiling of the cord to facilitate placental delivery. Okay, i-coil mo ang cord. And then ang Creed's maneuver, which is the third maneuver, is applying pressure on the abdomen. As you coil the cord, you support by applying pressure on the abdomen. This is to facilitate also the delivery of the placenta. So your Brandt-Andrews and your Creed's goes together. Pag-apply mo ng pressure, then you coil the cord. Okay? Then gently pull the placenta downward. Then take note for the time of placental delivery. Tanaw din ka sa oras, wag gawas. Kaya nag-deliver ka ng placenta, di ba? The passengers, the baby and the placenta. Okay? So yan yung gawa ng handle ng sa DR. Okay? Check for the type of placental delivery and then take the BP. The one that would take the blood pressure would be the assist. Dalawa kasi kayo yan, assist and the handle. Right? The assist will be beside the patient. She will be the one to take all the necessary vital signs needed and then report every now and then to the obstetrician. Doc, ang blood pressure ni patient is ganito, ganyan, ganyan. Then, if you have noticed some unusualities sa vital signs, you report it directly to the doctor or sa team na nandyan. you tell the team so that the staff would check it, okay? Or me, your clinical instructor. So whoever is free on a license, no, she will be the one to check it. Okay? By checking the BP of the client, this would be our baseline for giving Metrogyne administration. All right? Ang Metrogyne administration kasi hindi basta-basta yan. It is an oxytocin drug. Its purpose is to contract the uterus to prevent maternal bleeding. Okay, right after delivery. But it is not given if the BP is high because the side effect of Metrogyne is hypertension. All right? So check for the completeness of the cotyledons. No? Di ba sabi ko kanina, i-open up mo yan. I-turn upside down mo yung placenta. Then you count. You cannot really see. No? You cannot really see and count the cotyledons because it is very bloody. So all you need to do is to feel. No? Feel for hollow spaces. No? Ganin mo, gloved hands ka man, ganin mo yan. Then, after a while, if there would be no hollow spaces sa area ng placenta, then you report it to the obstetrician. Doc, placenta is complete. So, ibig sabihin, padayon na si Doc sa iyang management sa patient. So, you promote uterine contraction. So, there are ways wherein to check whether the uterus contracts or not. So, if it is not contracted, we can massage the hypogastric area, no, to stimulate the uterus to contract, or better yet, we get ice pack, no, and then place it on the hypogastric area. Cold can cause vasoconstriction, which therefore stimulate the placenta, the uterus to contract. Okay, so yan. Then next one would be administration of either oxytocin or Malic. So if this happens na hindi pwede si Malic, then mag-i-incorporate si Doc ng oxytocin via IVF. Aside from the one that is injected before the baby is out. No? Kasi dalawa kasi yan ini-inject, no? Oxytocin before the baby, after the baby is being delivered. So wala nang lalabas iba. So inject na si mother ng oxytocin for the uterus to contract na. Then of course, kasi dinudugo si mother kasi puno yung kanyang bladder, then we do catheterization. Okay? So empty the bladder, so much so, hindi makompress yung uterus. Kasi pag na-press mo yung uterus, the uterus would not contract. Okay? Then inspect perineum for lacerations because this might be the cause for the bleeding. No, there might be some laceration that needs to be sutured. Then assist in the episiotomy. Episiotomy is the surgical repair of the perineum or surgical repair of the episiotomy being done. Okay? Then after a while, if everything is managed already, you do the perineal care. Okay? Mahaba-haba din ang trabaho ng nurses dito. Then once everything is fine already, the patient has changed the gown, no? Na comfortable na si mother, no? Then apply natin ang contour brief or what we call adult diaper. Then you make the patient comfortable. All right, straighten the legs and then cover the patient with the top sheet, no? And then make the patient comfortable, then go back to the IVF and monitor or regulate the IVF as ordered. Okay? So what would be the nursing care on the 4th stage? So syempre, assess natin si Fundus kung nag-experience ba siya ng atomy or hindi siya nagko-contract. Check for bleeding, check the bladder, check the perineum. Okay? We always check the perineum or the vulva of the client because there is what we call tawag dyan, complication during the episiotomy, which is your hematoma, accumulation of blood within the tissues, which causes a lot of pain. Kasi yung blood mag-accumulate sa tissues ng patient, magburot yan siya. So, upon touching the area, the patient will say, aray, maganyan yung patient nyo, kawawa masyado, no? Ang haba-haba na kanyang ordeal while giving birth, and then yan pagyud, palpak pagyud ang episiotomy, no? Merong wala na suture. Then take the vital signs every 15 minutes until the patient is stable. Okay, then promote rest. So, hi! Salamat, Lord. Nahuman. Okay? So, that would comprise, guys. Asa na to? That would comprise the, what you call this one? The prelim. Alright? Until the 4th stage of labor. Okay. So, any questions so far? Basta na-detail ko na siya sulat po sa inyong handouts. So, when we see each other after the exams, tomorrow lang guys, expect for Equiper quiz, ha? If ever I will not be around tomorrow, kasi nga, meron kaming employees orientation 1 to 5, no? Natatamaan talaga always ang lectures after the RLE. That is why. So, ano tayo? Mayroon na akong hahanda na Equiper quiz. So, it will start 4 in the afternoon, guys. Ha? 4. So, make sure to check your notification ba ninyo na ano. Ano kaagad na ilang items, ma'am. So, titingnan ko pa. Alright? Kasi maano naman yan doon sa ano, sa Equiper. Gagawa pa ako doon. Gagawa pa ako. Isi-send ko sa inyo ang code tonight. Alright? Kasi nga, Google Drive ako ng Google Drive. It is because, I was assuming na wala pa ang ibang Equiper kasi hindi man natapos sa enrollment. So ngayon, patapos naman tayo. Depende lang po yan kung ilang sets of quiz ang gagawin ko tomorrow. Kasi ang time naman natin 4 to 6, right? So, murag ya po mga exam. Basta, of course, include whatever we discussed tonight. Alright? Okay. Okay. So, whatever we have discussed, yung mga days na yung kanina, review lang yun. No? So, gagawa ako ng tama pala no, gagawa pa ako ng Equiper code. Gagawa pa ako class list, guys. Okay, then isend ko sa GC ang code and make sure na mag-in kayo ha para maka-quiz kayo. So, kung mabigay ko ang Equiper code tonight, mag-in na kayo kaagad. Kasi kung magtagal-tagal kayo tomorrow, hindi mag-appear ang quiz sa inyo, baya. Na-experience ko na yan sa student ko. Parang 2 hours or 3 hours before the quiz, walang mag-appear na quiz sa kanya, guys. Hindi siya sinali sa class. Okay? So, I do hope na pagbigay ko ng code, everyone should get in or sa Equiper. Okay? Sige. So I think I am done for tonight. So can I call on Miss Onde to lead us in prayer?
Let us bow down our heads and feel the presence of God. In the name of the Father, the Son, and the Holy Spirit. Lord, we want to thank you for this evening, oh God, for the knowledge imparted to us from our clinical instructor. We pray, Lord, that this knowledge will be used for our practice, oh God. Guide us in everything that we do and wherever that we may be. We give you back all the glory, praises, and honor in the mighty name of Jesus. Amen.
Okay. So guys, wait for tomorrow's announcement tomorrow, okay? Just in case.